right now, tonight, while millions of seniors across this country prepare for bed, a hidden threat is getting ready to go to work. Not a virus, not a tumor, not anything a standard checkup would catch. Something that happens in the quiet of your own bedroom, in the hours you spend completely unconscious, completely unaware, completely vulnerable. Research published in the European Heart Journal tracked thousands of adults over 60 for years and found that specific combinations of ordinary bedtime habits were dramatically increasing the risk of fatal heart events during sleep. We are not talking about minor increases. We are talking about risk levels that fundamentally change whether you wake up tomorrow morning. I'm Dr. Alastair Pembroke, and you're watching this channel because you believe your health deserves honest, evidence-based answers, not fear tactics, not supplements pushed at you every 2 minutes, and not watered-down information that leaves you more confused than when you started. If that sounds like what you're looking for, subscribe and hit the notification bell so you never miss a video. Today, I'm going to walk you through 6 specific things that seniors are doing before bed right now, tonight, that are silently setting the stage for heart attack and stroke. These are ranked from 6 down to 1. And I'll tell you this, by the time we get to number 1, you will understand why so many people who seemed perfectly fine simply never wake up. Pay close attention. This could be the most important thing you watch this year. Before we get into the 6 habits, you need to understand something that most people, even many doctors, don't fully appreciate during a routine appointment. Your heart does not simply rest when you go to sleep. It enters a highly specific biological program. In a healthy adult, blood pressure drops between 10 and 20% during sleep. Cardiologists call this nocturnal dipping, and it is not optional. It is one of the most critical repair cycles your entire cardiovascular system depends on. During those hours, your heart muscle recovers, your arterial walls decompress, your brain clears metabolic waste products linked to cognitive decline. Your autonomic nervous system rebalances itself for the next day. When that program is disrupted, even partially, even for just a few nights in a row, the damage accumulates. The journal Hypertension has documented that adults whose blood pressure fails to dip normally during sleep, a condition called non-dipping, face significantly higher rates of stroke, left ventricular hypertrophy, and kidney damage compared to healthy dippers. The terrifying part is this. Non-dipping produces no symptoms you would notice. You feel fine. You wake up. You go about your day. But underneath the surface, your cardiovascular system is aging faster than it should, accumulating damage that eventually reaches a threshold from which it cannot recover. Every single habit I'm going to describe today directly interferes with this overnight repair program. Understanding that framework will help you grasp why these habits are not just inconvenient, but genuinely dangerous. Here is something nobody tells you clearly enough. The same bedtime habits that a 35-year-old gets away with without consequence can be genuinely dangerous for a 65 or 70-year-old. This is not about being fragile. This is biology. After age 60, the cardiovascular system changes in ways that matter enormously for what happens during sleep. Arterial walls become less elastic. The heart's electrical system becomes more susceptible to rhythm disruptions. The autonomic nervous system, which governs the balance between stress responses and recovery, becomes less efficient at switching modes. The hypothalamus, the part of the brain that regulates thirst, temperature, and sleep cycles, begins to lose sensitivity. Melatonin production, which protects blood vessel walls as well as promoting sleep, declines significantly with age, according to research in the Journal of Pineal Research. Kidney function changes, affecting how the body handles fluid and electrolyte balance overnight. The result is a cardiovascular system that has significantly less margin for error when it encounters disruption during sleep. A habit that costs a younger person a slightly poor night's sleep costs an older adult something far more serious: a blood pressure spike that doesn't recover, a rhythm disturbance that tips into atrial fibrillation, a clot that forms in thickened, sluggish blood. Every habit I'm about to describe becomes more dangerous, specifically because of these age-related changes. Keep that in mind as we go through each one. Coming in at number 6 is a habit so common, so deeply woven into daily routine, that most people never think twice about it. Eating a large meal within 2 to 3 hours of going to bed. When you eat a substantial meal, your digestive system demands an enormous surge in blood flow. Your heart must work significantly harder to redirect circulation toward your stomach and intestines to process that food. Research from the University of Sao Paulo found that in adults over 65, the blood pressure elevation following a large meal averages more than 20 points and can persist for up to 3 hours. Now consider what that means when it overlaps with the early phase of sleep, the very window when your body is attempting to begin that critical overnight blood pressure dip. That dip never gets a proper start. Beyond blood pressure, eating late creates a second threat through acid reflux. When you lie flat with a full stomach, stomach acid travels upward far more easily than when you are upright. In older adults, the lower esophageal valve that is supposed to prevent this weakens considerably. When acid reaches the esophagus, it can stimulate the vagus nerve, which directly influences heart rhythm, and in people with underlying susceptibility, this vagal stimulation can trigger irregular heartbeats. The practical solution is straightforward. Finish your last full meal at least 3 hours before sleep. If you need something in the evening, a small portion of easily digestible food is fine. And research published in Sports Medicine found that even a 10-minute walk after dinner meaningfully reduces the blood pressure and blood sugar impact of that meal. Number 5 is one of the most actionable and potentially life-changing pieces of information in today's video. And the majority of people watching this right now are almost certainly doing this wrong. Most people who take blood pressure medication take it in the morning. That is what most of us are told. That is the default. But a landmark trial published in the European Heart Journal, the Hygia chronotherapy trial, followed nearly 19,000 patients over 6 years and found something that should have changed prescribing habits worldwide. Patients who took their antihypertensive medication at bedtime instead of in the morning showed dramatically lower rates of heart attack, stroke, and cardiovascular mortality compared to those taking it in the morning. The biological explanation is something called nocturnal hypertension. Blood pressure in many people surges dangerously during the early morning hours, typically between 3 a.m. and 6 a.m. This is the precise window when the majority of heart attacks and strokes occur. When medication is taken in the morning, its peak effectiveness arrives around midday and diminishes by the time the early morning danger window opens. When taken at bedtime, it reaches full effectiveness exactly when the body needs it most. This is not a fringe finding. This was a large, well-conducted trial. However, critically, medication timing is not something to change unilaterally. Some medications must be taken with food. Some individuals have specific clinical reasons for morning dosing. Bring this research to your next appointment and have a direct conversation with your physician about whether bedtime dosing is appropriate for you. That single conversation could significantly alter your cardiovascular risk profile. Number 4 is what I call the silent dehydration trap, and it operates through a mechanism that most seniors have never been warned about. Here is the paradox. The very thing many older adults do to protect their sleep, limiting fluid intake in the evening to avoid nighttime bathroom trips, quietly makes their blood more dangerous while they sleep. As we age, our kidneys become less efficient at conserving water, and the brain's thirst signal weakens, meaning significant dehydration can be present without any feeling of thirst. Research from the University of Connecticut confirmed that older adults can reach meaningful dehydration without triggering the normal warning sensation. When you are dehydrated during sleep, your blood becomes thicker and more viscous. A thicker blood is harder to pump, places more strain on the heart and forms clots far more readily. This is the precise mechanism behind many strokes. The solution is not to drink a large amount of water right before bed. Instead, drink a full glass of water with some source of electrolytes, particularly potassium and magnesium, roughly 2 hours before sleep. Moving to number 3, chronic exposure to screen light in the hours before bed. Blue wavelength light from phones, tablets, and televisions directly suppresses melatonin production. Beyond sleep, this matters for your heart because melatonin is a potent antioxidant that protects the lining of your blood vessels from the oxidative damage that drives plaque formation and arterial stiffening. Research from Brigham and Women's Hospital, affiliated with Harvard Medical School, has documented melatonin's significant cardioprotective role. In older adults, whose melatonin production is already substantially reduced with age, further suppression from screen use removes a layer of protection the heart genuinely needs. Stop screens at least 90 minutes to 2 hours before sleep. Here is something that does not get discussed nearly enough, and it is the reason why focusing on just one of these habits while ignoring the others misses the point entirely. These risks do not simply add together. They multiply. Consider what happens in a single night when several of these habits are present simultaneously. A late, heavy meal keeps blood pressure elevated as sleep begins. Inadequate hydration thickens the blood throughout the night. Screen exposure suppresses melatonin, reducing vascular protection. Backsleeping collapses the airway, triggering repeated surges of stress hormones that spike blood pressure dozens of times across the night. Unresolved emotional stress keeps cortisol elevated, preventing the blood pressure dip that would give the heart its essential recovery time. Each individual factor stresses the cardiovascular system. Together, they create a sustained overnight assault that the aging heart has limited capacity to absorb. Cardiologists refer to this cumulative overnight stress as a cardiovascular burden. Research consistently shows that the risk is not proportional. This compounding is why two people with similar daytime risk profiles can have vastly different cardiovascular outcomes. One sleeps well with clean bedtime habits. The other accumulates a cardiovascular debt night after night, invisible, asymptomatic, building toward a threshold the body cannot survive. Understanding this compounding effect is what makes the habits I'm describing today far more urgent than any individual statistic suggests. Your bedtime routine is not separate from your heart health. It is one of the most important cardiovascular decisions you make every single day. We have arrived at number 2, and I want you to genuinely hear this one out before you dismiss it, because the research behind it is among the most compelling and most overlooked in cardiovascular sleep medicine. When you sleep flat on your back, gravity causes the tongue and soft tissues of the throat to fall backward, narrowing or fully blocking the upper airway. This is the central mechanism behind obstructive sleep apnea, a condition that medical estimates suggest affects a substantial proportion of adults over 65, the majority of whom have never received a diagnosis. During an apnea episode, the brain detects the drop in blood oxygen and triggers an emergency response, flooding the body with cortisol and adrenaline. Blood pressure spikes sharply. The heart rate surges. These episodes can occur dozens to hundreds of times per night, each one brief enough that the person never fully wakes up, but significant enough to prevent the blood pressure from completing its essential nocturnal dip. The American Heart Association officially classifies untreated sleep apnea as a major independent risk factor for hypertension, atrial fibrillation, heart attack, and stroke. Research published in Circulation by Gami and colleagues found that adults with obstructive sleep apnea had significantly elevated risk of sudden cardiac death during sleeping hours compared to the general population, with the risk concentrated in the early morning, the same window when blood pressure surges are highest. If you share your bed, ask your partner whether you snore loudly or appear to pause breathing. If you sleep alone, record yourself for one night. The signs are often unmistakable. Sleeping on your side, particularly the left side, reduces airway collapse substantially. If sleep apnea has been diagnosed, consistent use of CPAP therapy is among the most powerful cardiovascular interventions available. Before we reach number 1, I want to make sure you understand the biological mechanism that connects everything we've discussed today. Because without understanding it, habit number 1 may not seem as serious as it actually is. The mechanism is cortisol, your body's primary stress hormone. In a healthy overnight cycle, cortisol levels drop during the first half of sleep, reaching their lowest point around midnight, then gradually rising toward morning to help prepare the body for waking. This rhythm is not merely about mood or energy. It directly governs blood pressure patterns, inflammatory activity in blood vessels, blood clotting tendency, and the electrical stability of the heart. When evening cortisol is chronically elevated, this entire rhythm is disrupted. Blood pressure fails to dip. Vascular inflammation increases. The heart's electrical system is exposed to an environment that promotes arrhythmia. Blood tends toward clotting rather than flowing freely. Research published in Psychosomatic Medicine and supported by long-term cardiovascular studies at Johns Hopkins has documented the relationship between chronic nighttime stress and elevated cardiovascular mortality with remarkable consistency. The older we get, the less efficiently the body clears cortisol between stress exposures, meaning an 80-year-old experiencing an emotionally stressful evening recovers far more slowly than a 40-year-old in the same situation. The physiological debt of a stressful evening is greater, lasts longer, and does more damage in an older cardiovascular system. This is the context you need for number 1. Before I give you number 1, I want to pause and give you something immediately actionable, because some of you watching this may already be experiencing warning signs that deserve attention now rather than later. If you regularly wake during the night with your heart racing, feeling of breathlessness, or a sense of pressure in your chest, do not dismiss these. These can be signs of nocturnal hypertension, arrhythmia triggered by sleep apnea episodes, or cardiac events requiring prompt evaluation. Call your physician and describe these symptoms specifically. Do not wait for your next scheduled appointment if these symptoms are happening regularly. If you wake with sudden severe chest pain, pain radiating into your arm or jaw, sudden confusion, face drooping, or difficulty speaking, these are potential emergency signs. Call emergency services immediately. Do not drive yourself. Do not wait to see if it passes. Time is the single most critical variable in both heart attack and stroke outcomes. For those of you whose symptoms are milder, such as poor sleep quality, daytime fatigue, or morning headaches, these can all be indicators of sleep apnea or nocturnal hypertension and are absolutely worth discussing with your doctor. Request a sleep study if sleep apnea is a possibility. Request a 24-hour ambulatory blood pressure monitor if nocturnal blood pressure patterns are a concern. These are standard, accessible tests that your physician can order, and the information they provide is far more useful than a single office blood pressure reading. Your overnight health is a distinct clinical picture from your daytime health. Make sure your doctor has the complete picture. Now that you understand the risks operating during sleep, here are 3 specific clinical tests worth discussing with your physician at your next appointment. These are not exotic investigations. They are standard, accessible tools that provide information your regular checkup cannot. The first is ambulatory blood pressure monitoring, sometimes called ABPM, or a 24-hour blood pressure test. Unlike a single office reading, this wearable device records your blood pressure at regular intervals across an entire 24-hour cycle, including during sleep. It directly reveals whether you have nocturnal hypertension or a non-dipping pattern, which carries significantly higher cardiovascular risk than daytime hypertension alone, and is entirely missed by standard office measurements. The second is a sleep study, or polysomnography, and for a simpler screening option, a home sleep apnea test. Given that a large proportion of older adults have undiagnosed obstructive sleep apnea, and given its direct link to arrhythmia, hypertension, and sudden cardiac death during sleep, this test can be genuinely life-changing. If a home test suggests apnea, a full in-lab study provides definitive diagnosis and guides treatment. The third is a high-sensitivity C-reactive protein test, or HSCRP. This blood test measures a specific inflammatory marker in your vascular system. Elevated HSCRP is associated with increased cardiovascular event risk and can reveal vascular inflammation that standard cholesterol panels do not capture. Together, these three tests provide a far more comprehensive cardiovascular risk picture than a standard annual checkup, particularly for the overnight and inflammatory dimensions of heart and stroke risk. Let's be concrete about what actually works. Because health information that stops at describing risks without giving you actionable solutions is not genuinely helpful. 4 evidence-based strategies that directly counteract the bedtime risks we've discussed today. First, the 3-hour meal cutoff combined with a 10-minute post-dinner walk. Research supports that stopping substantial food intake 3 hours before bed reduces nocturnal blood pressure elevation and acid-related vagal stimulation. The brief walk after eating is supported by research published in Sports Medicine showing meaningful reductions in postprandial blood glucose and cardiovascular load. Second, consistent side sleeping, ideally left side when possible. This single positional change reduces airway collapse risk substantially. A body pillow placed behind the back prevents unconscious rolling to the supine position. For confirmed sleep apnea, consistent CPAP use dramatically reduces nocturnal blood pressure spikes and arrhythmia burden. Third, a structured technology cutoff. Discontinuing screen use 90 minutes to 2 hours before bed allows melatonin production to resume, restoring cardiovascular protection. Replace screen time with reading physical books, light conversation, or relaxation practices. Fourth, magnesium-rich foods or supplementation in the evening. Magnesium supports vascular relaxation, helps maintain normal blood pressure, and has been studied for its role in sleep quality in older adults. Foods naturally rich in magnesium include pumpkin seeds, dark leafy greens, almonds, and black beans. Supplementation, if appropriate for your specific health situation, should be discussed with your physician, particularly if you have kidney conditions. The cardiovascular risks associated with poor sleep habits are not uniform across age. They intensify and accelerate with each decade, and understanding this helps explain why a habit that seemed harmless at 50 may genuinely not be at 70. In your 50s, the cardiovascular system still has considerable resilience. Arterial elasticity is declining, but the margins are relatively wide. The autonomic nervous system still recovers efficiently between stress exposures. Sleep apnea may already be developing, but the cardiovascular consequences are still in early stages. In your 60s, the picture changes meaningfully. Arterial stiffness has increased substantially. The kidneys are less efficient. Melatonin production has declined. The electrical system of the heart is more susceptible to rhythm disturbances. The consequences of a non-dipping blood pressure pattern or repeated apnea episodes are more serious and accumulate more quickly. After 70, the margin narrows further still. Cortisol clearance is slower, meaning evening stress lingers physiologically longer into the night. The thirst mechanism is less reliable. The lower esophageal valve protecting against acid reflux weakens. The heart's capacity to absorb and recover from repeated overnight stress events is genuinely reduced. This is not cause for alarm. It is cause for intentional action. The research is equally clear that meaningful improvements in sleep habits at any of these ages produce real, measurable cardiovascular benefits. The biology of improvement does not have an age cutoff, but the urgency of acting increases with each passing year, and there is no better time to make these changes than tonight. There is a significant gap between what cardiovascular sleep research has established and what most people discuss with their primary care physicians during a standard appointment. Understanding that gap helps explain why these risks have continued quietly affecting millions of people who believe they are doing everything right. Standard cardiovascular care focuses heavily on daytime measurements, office blood pressure readings, fasting cholesterol panels, resting electrocardiograms. These are valuable, but they capture only a portion of cardiovascular risk. The overnight dimension, nocturnal blood pressure patterns, sleep-disordered breathing, nighttime cortisol rhythms, and circadian influences on medication effectiveness has been less integrated into routine clinical practice despite a substantial body of research supporting its importance. The Hygia chronotherapy trial demonstrated that medication timing, something almost never discussed in a standard appointment, significantly alters cardiovascular outcomes. Sleep apnea research in Circulation and the American Heart Association journals has documented the relationship between undiagnosed sleep apnea and sudden nocturnal cardiac death with consistency that should prompt routine screening in older adults. Research on nighttime screen exposure and melatonin's cardiovascular protective role has accumulated substantially in peer-reviewed literature. The common thread across all of this research is that the hours between midnight and 6 in the morning are not passive. They are active cardiovascular territory, shaped by choices made hours earlier in the evening. The bedtime routine is not a trivial matter of personal habit. It is a cardiovascular intervention, either working for your heart or quietly working against it. Let me bring everything together with a clear, specific action plan you can begin implementing tonight. Because information that doesn't translate into action has not actually helped you. The 6 habits we've covered, ranked from least to most dangerous, are eating large meals within 3 hours of sleep, taking blood pressure medication in the morning when evening timing may be superior, allowing dehydration to develop through the night, exposing yourself to screens in the final 90 minutes before bed, sleeping on your back and leaving potential sleep apnea unaddressed, and carrying unresolved emotional stress and worry into the sleep hours. Your 3-step action plan for this week. Step 1. Tonight, move your last full meal to at least 3 hours before you plan to sleep. Stop screens 90 minutes before bed. And if you typically sleep on your back, place a pillow behind you to encourage side sleeping. Step 2. This week, drink a full glass of water with some potassium and magnesium source roughly 2 hours before sleep. Begin a brief wind-down practice in your final 30 minutes before bed. This does not need to be elaborate. Writing down 3 things that went well today is supported by research as genuinely effective at reducing cortisol before sleep. Step 3. At your next medical appointment, ask your doctor about ambulatory blood pressure monitoring, a sleep apnea assessment, and whether your current medication timing is optimal for your overnight blood pressure profile. These conversations take minutes and can be life-changing. As always, nothing in this video replaces the advice of your personal physician who knows your complete medical history. This is health education, not a prescription. I'm Dr. Alistair Pembroke. If this gave you something valuable, subscribe to this channel, share this video with someone you care about, and leave a comment telling me which of these 6 habits surprised you most. Your health is worth protecting. Now you know how.